Do you know which disease is one of the leading causes of disability worldwide? Which disease is affecting millions and millions of Americans every year? Do you know? You know what? Let's cut the crap and get to it. I'm talking about depression. Mr. Tor, I see everything looks great. Your lab work is all normal. How have you been doing recently?
I'm fine.
Can you explain more?
I'm okay, it's life.
How have you been feeling over the past couple weeks?
A little sad,
Okay, would you say like you've been feeling sad almost every day for the past 2 weeks?
Pretty much, yeah, pretty much.
Like, can we talk about it further? I know you told me that you enjoy a lot of sports. Have you been enjoying those as much as before?
Not really. I haven't been doing much.
Okay. Any changes in your energy?
I don't do much during the day, I'm pretty much on the couch every day.
Yeah, do you feel like you have to push yourself to get things done?
Oh yeah, definitely. I don't get anything done pretty much.
Okay, any changes in your concentration, like when you are watching a TV show or you're reading something, noticing that you have to go back, you're kind of like lost track of things?
Yeah, I lost my concentration as well.
Okay. Any changes in your appetite, decreased or increased, or feeling like you have to push yourself to eat, or you're eating too much?
I am kind of, eating too much, I guess. I eat a lot of pizza and, I eat out.
Got it. And any changes in your sleep, either like sleeping too much or like not sleeping at night, like it's like waking up a couple times at night?
Oh yeah, I don't get enough sleep at night. I have trouble going to sleep, and I have a lot of, nightmares, and I wake up and...
Any feeling of like thinking about past, like things that happened before, kind of like ruminating about those, like what should have, would have, could have stuff, a lot of thoughts like that?
I don't know, maybe sometime.
Sometimes when people like feel like this, they might feel like life is not worth living, or if I don't wake up tomorrow morning, it's fine. Have you had those kind of thoughts lately?
I guess, to be honest, yeah, I've had that once. It's not like I want to kill myself or anything, but it's just not meaning anything to me anymore.
Thank you for sharing that with me. I think you have depression, Mr. Tor, and I think we need to treat it.
It isn't a big deal, I guess I have to deal with it. Depression is not a real, illness or anything.
What? Actually, depression is a real disease, and it's a very common one. A lot of us feel sad, and it's absolutely normal to feel sad, but having all of these symptoms, or at least 5 out of these 9 symptoms for 2 weeks, almost every day, it is depression.
But I thought depression only affects women.
You gotta be kidding me. No, Mr. Tor, that is simply not true. A lot of studies show that, like, yes, women are more common to report their symptoms, but depression does affect men as well. But because of the stereotype around feeling sad or depressed, some men might not feel comfortable reporting their symptoms.
But I'm not a weak person, I'm sure I can snap out of it.
That is exactly why people wait and wait and wait till they show up and ask for professional help, because we simply think we can snap out of it. Mr. Tor, this is another common stereotype that exists around depression. Depression is not a sign of weakness or self-pity or even laziness. Depression is a medical illness.
But you know why it happened? I lost my brother about a year ago, and that's why I'm so sad, I guess.
Oh God, there is a difference between normal sadness and pathological sadness. How do I explain it to him? Yeah, depression can be because of our environmental factors, but it doesn't mean that it doesn't need treatment.
You know what? Now I know. My mom was depressed. That's why I'm depressed now.
Can we stop blaming our moms for every single thing? Actually, you brought up a very good point. The studies have shown that if you have a family member, especially a first-degree relative who have been diagnosed with depression, chances of you getting depressed is higher than general population, but it's not the only factor. So here is what I recommend. I would suggest we start psychotherapy. I will refer you to a therapist. And I would also recommend you starting a medication that can help with depression.
Talk therapy? I don't think so. I think talking about it only makes it worse for me.
Among all the 1,000 things that can make your depression worse, I would say talking is not one of them. Actually, lots of research have shown that talk therapy or counseling or psychotherapy, they are even as effective as medication in treating depression. Actually, the recommendation is therapy plus medication is more effective than either of these alone.
But doc, listen, these medication, I think they will change my personality.
I wish we had a medication that can change your personality. This is something that I hear a lot, but it's a false belief. These medications change the brain chemistry and that's how they help with your symptoms, but they don't change your personality.
But if I take these medications, I think I'll get addicted to them and I'll have to take them forever, right?
If I could only have $1 for every single time I hear this. Most of antidepressants don't do that. You might need to take them for a long period of time, but it doesn't mean that you're going to get addicted to them. There is a category of medication that patients can get addicted to, like benzodiazepines, like Ativan, Klonopin. That's why we don't prescribe them for a long period of time.
But doc, my mom, when she was diagnosed with depression, she took these medication for about 2 weeks and nothing. She wasn't treated.
Oh God, help me out. Oh, I see. Let me straighten this out. For most of antidepressants, you need to take them for at least 3 to 4 weeks consistently in order to see any benefits from them. Actually, in the very first week, you might see more side effects rather than any benefits. And that's why a lot of people stop them after taking for the first week.
All right then, I'll take them on the days that I feel sad and depressed.
Oh God, I think he's just trying to kill me. Antidepressants are not like painkillers. You need to take them every single day. Even if you feel a little bit better, you need to continue taking them so they reach the therapeutic level in your body. Does it make sense?
I mean, I don't know.
Yeah, every day we see a lot of people who have these false beliefs or don't take their medications or don't seek out professional help because of this stuff. Please, don't be one of them. And if you have someone around you with these false beliefs, please correct them.
And if you like this video, don't forget to subscribe and share and hit the bell and comment below in the comment section. Thank you.